Hello, everyone. This is Susan Martin from Bauer Center for the Arts, and you're listening to the Behind the Bauer podcast. This show offers inspiring conversations, a fresh look at arts in our community, and provides spotlights on artists, performers, collaborative partners, educators, and other organizations in our area. We want to celebrate the universal expression of human experiences through arts, culture, and involvement in our community. And today we're going to be talking with Carrie White. She's Chief Nursing Officer of Centra, Bedford Memorial Hospital. And just a little bit of information, Centra's mission is to improve the health and quality of life for the communities that they serve, obviously Bedford with Bedford Memorial Hospital. And in addition to the inpatient and outpatient services provided by Bedford Memorial Hospital, the campus also houses several additional facilities with services ranging from primary care to satellite specialty services and more. And we're going to try to get into all of that. So today we're going to learn about the services, but also going to talk more about Centra and Bedford Memorial Hospital's community involvement and some of the upcoming events. So I want to say good morning and welcome to Carrie.
Yes, thank you so much for having me.
So we always just like to have you tell our listeners, share a little bit about yourself and maybe why you got into nursing.
Yeah, so I've been with Centra for 17 years, which I'd like to say I'm 21. How can I have been there for 17 years? No, but it's
just from birth to
Centra's been great. I started out in the emergency room as a brand new nurse. Went to Centra College. It was actually Centra Lynchburg General Hospital School of Nursing at the time.
Mm-hmm.
So went there, and the ED was great. But then when I was starting to, get married and have kids, I went into surgical services just to do something a little different.
Right.
And spent most of my career there as a bedside nurse and as a manager of all the different perioperative areas. So in the OR and PACU prep room, everything, surgical services.
Yeah.
I did that for many years, did some management roles and things like that, and then became our nursing business strategist of the system last year.
Okay.
Did that for about a year, and that was a really incredible role where I got to get into recruitment and retention and recognition of our nursing profession. After COVID, it was just very needed.
Yes,
and
definitely.
So then moved into the chief nursing officer role here at Bedford. So new to Bedford. I've been in this position probably about 8 months. So.
Oh, wow. Yeah. Well, welcome to Bedford, to the hospital in Bedford. So do you live in this area or do you live out of Lynchburg?
I actually live in Lynchburg, but I travel.
Yeah. So have a little bit of the commute there.
Yes.
What do you think has influenced or impacted you to stay with Centra for so long? What is it about that has made you want to?
Yeah. So quite honestly, my parents got a divorce when I was 18 years old, and I was actually at VCU, and I was going to be an occupational therapist. And when my parents got the divorce, it was just one more thing to fight about who was going to help pay for my college. So I just took a break from college for a little bit and got through that life event. And Centra College, or Lynchburg General Hospital School of Nursing at the time, they actually paid for my school.
Mm-hmm.
So I was a dental assistant, and I worked at Bahama Snow Shack during the day. And then at night, or kind of just around that, I had a really great group of leaders in those two jobs who worked around my schedule. So during the day, I would go to school. And when I got off school, I'd clean. It was a pediatric dentist, and I'd clean teeth, and then I would go work at Bahama Snow Shack during the night. So I was able to do that. They were covering the cost of my school, and they paid for it. And then I worked in the ED for a year, and I said, hey, I was going to go for a bachelor's degree at VCU. I should just keep going.
Right.
So they paid for my RN to BSN. I went to UVA, and they let me go every Tuesday. Well, I worked nights in the ED. I worked from 3P to 3A. But on every Tuesday, I'd actually travel to Charlottesville.
Okay.
And I got my BSN, and Centra paid for that. And then, after my first child, I went back and got my master's. They paid for it.
Right.
They do tuition reimbursement. Sorry, I couldn't get that word out. And it's up to 80% up to $5,200 a year. So I just always have done it really slowly.
Right.
I'm getting my doctorate right now, but I don't talk about it. It's a lot.
My daughter's getting hers right now too, but she's in education. So
I feel for her. I understand. It's a lot.
Yeah. So if you had anything to say to any individuals out there that are thinking about going into nursing or I know some other folks that have gone through the Centra program or college. It just seems like they're very flexible and willing to work with anyone.
Yeah, and that's the thing. I didn't really finish up, but if you're willing to invest and you want to grow, the opportunity is really there.
Right.
So throughout my career, I've never felt like unseen. I've wanted growth. I've wanted to do management. And do all those things.
Right.
So if that's something you want and you get, the requirements like the degrees, you can be super successful.
Right.
And so, with nursing, Centra College is a great school. We have CNA, LPN, RN programs, and they're quick.
Right.
They're really quick. And the teachers there are fantastic.
And there's definitely no lack of need for nurses of all levels. In any community. But
yes. So we are really, we want our own nurses.
Right.
We appreciate the travel nurses. They have helped us, lots of hospitals through a really hard time. But it's just nice to have your own standard folks, right? And so, it's just really, it's a big thing. It's a big thing. Nursing is a great profession. And like I said, there's so much value in that nurse that stays by the bedside their whole career.
Right.
They are experts and they guide the new people, right? And, the new blood also motivates your people who have that high retention.
Right.
And kind of need that bright new nurse coming in, nervous. It kind of motivates you.
Right.
You feel useful because you can precept them.
Right. Yes. We're real fortunate too at Bauer Center for the Arts. One of our studio artists, Eric Bryant, is an emergency room nurse at Bedford Memorial Hospital. And he actually started... He was accepted into what was called our Emerging Artist Program, and it was the year of COVID.
Yeah.
And so he did his art residency and had a studio at our space, and was fortunate enough to be able to use it a little bit longer than the normal residency because of COVID, and we couldn't open it up to a new artist. And then he also became very fortunate in that one of our artists unfortunately had to move out because of COVID, which made a space available for him to stay permanently. So we love seeing him in the Bauer Center and talking with him about his work life and how he finds time to do his art and that kind of thing. So we love that relationship.
Well, Eric is fantastic. So he works in our emergency room and our supervision team. And it's so funny because we were just doing the CTE Expo at Susie G just last week. So we were introducing 7th grade students to healthcare careers that's all I cared about. There were other people.
Right.
Anyways, he was actually, it's funny you say that because he was showing me a portrait he had drawn. And I was like, I didn't know you had this talent. Then he was telling me, I used to work on a dude ranch. And I'm like, what?
He's got a lot of interesting jobs.
But I think that art, that's incredible because, we all need our outlet. So I'm telling you, Eric's got a stressful job. Couple jobs, right? And, just another example of a rising leader, right? But art, that connection to just wellness and stress relief,
right?
Our caregivers really need that. So
right. Yes,
and then we can mix those two.
In addition to that, you may not be aware, we have a collaborative, what we call Art Reach or Arts Outreach. We actually work with the Adult Day Center that brings clients over and typically about twice a month, and we do art programming with them at the Bauer Center for the Arts. And we've also recently had some folks from the Centra PACE program come as well. So we know how important it is. The arts can be healing. They are an opportunity to express yourself in so many different ways. And so we really enjoy collaborating with Centra and Bedford Memorial Hospital and all of the other services, we love collaborating and offering those opportunities.
That's really neat.
We're also currently working, one of my board members is also working with some of your folks. We're looking to get some actual art in the emergency room, waiting room, and possibly in some other areas, and maybe doing some of Eric's artwork on the walls to show that somebody that's a nurse there is also an artist as well. So we're real excited about that.
I love that.
Yeah.
Awesome.
Well, we also want to talk a little bit about some of your upcoming events and activities. So I'll let you tell me which one you want to kind of chat about first.
Yeah. So Stroke Smart Health Fair is the one that I really want to talk about. So we have that coming up on Saturday, October the 21st. So we're kind of mixing a health fair focused on strokes with a walk with a doc. And I don't know if you've ever heard about walk with a doc.
I have, yes.
But for those that haven't heard about it, we have a physician come and they give a spiel. I mean, usually it's just 10 to 15 minutes of time.
Mm-hmm.
And so we're going to have Dr. Gon come, who is an interventionalist for Centra, extremely talented. We're so lucky to have him. And he's going to talk about strokes from what he thinks the community would benefit from.
Mm-hmm.
Nothing too formal. You don't have to answer questions.
Right.
He just gives information, gives people, the community is who we hope come. It's right in front of Bedford Memorial, right in front of those columns there. And then he actually takes everybody for a walk.
Right.
So we have a path. We call it a wellness path. And we go right around Bedford, do a walk just to kind of just promote that behavior. Right. And then after that, we'll have a fair. So October 26th, the walk will take from 8 o'clock probably to 8:30 or 8:45. Everybody gets a free shirt.
Uh-huh.
They're really nice. And then from 9 to 12, we'll start with the Stroke Smart Fair.
Okay.
And so, strokes have been just near and dear to my heart. Super preventable thing. And I've got some statistics here. Every 40 seconds, someone in the United States has a stroke.
Mm-hmm.
And every 3 minutes and 11 seconds, someone dies of a stroke in this country. So it's huge.
It is.
And my father-in-law just passed away of a stroke a couple months ago. But very preventable.
Yes.
And so at the fair, we are going to have different tables. And so, we really want to talk about prevention, right? Because we don't always start there.
Right.
But for healthy people that can come to this fair, we can really talk about, hey, here's how you prevent. Do you have a primary doctor? That's really the first step is having a primary doctor. You need to see your primary doctor annually,
right? No
matter what age you are. I feel like I'm young and I'm healthy and I'm going, gosh, today I have an appointment just to get my regular lab work, touch base with my doctor. But yeah, so we're going to have, actually it's a partnership with some different people for this project, which is really cool. So we have, the Virginia Department of Health is going to be there. BREMS is going to be there. And we're going to have, of course, Centra there, but, so we'll have that preventative care where we talk about those doctor visits.
Right.
And we'll have also just during your stroke type care. So we've got physical therapy, OT, who's going to be there. And then, post-stroke care. So we'll have places like PACE and things like that.
Right. Right.
Now with the VDH, they'll be doing some nutrition information. We have Beth Hunt, who I'd like to mention. She's our stroke coordinator. She's fantastic. I think I saw recently she just got inducted into the AHA board, which is a huge deal, big deal. But she's just going to go over recognition of a stroke.
Right.
And also we're going to teach children about strokes because, all these projects that we do, they kind of have to go through a process where they're approved. And when I presented it to a group, they said, well, what about kids? We're focusing so much on adults, but what about kids? So I have 2 young children and they're with my dad all the time. And so, what if my 10-year-old's with my dad and he starts exhibiting symptoms? It's just never too early to learn. Right. Because they could
something they could be aware of.
Yes. Yeah, just all kinds of resources we're going to do education. And like with the kids, we even have coloring pages, things like that to kind of educate them. But, at Centra, we have a big focus on Be Fast. So it's a mnemonic here where we talk about different ways that you can notice a stroke. So since I'm on a podcast, I've got to put a plug in for education. And we'll have Tiffany Little at that Stroke Smart event too. And so she's our patient educator for the hospital. So she'll have a table there too. So lots of people there, lots of caregivers volunteering. And remind me after I put this plug in to kind of go back on free blood pressure cuffs, because we're going to do blood pressure screenings too. Yeah. But so Be Fast. So listening to this podcast, if you get anything from it, focus right now on this moment. But so Be Fast is a mnemonic for balance, eyes, face, arms, speech, and time. So balance is if you see somebody have a sudden loss of balance. If they complain of eyes, a vision loss. Their face, if you see somebody smile at you, or if they raise their eyebrows and it's asymmetrical or not even, looks funky, that can be a sign of a stroke. Arms and legs, if they lift up their arms and one of them is weak and doesn't come up, that's a sign of a stroke. And then speech, if they have any type of slurred speech, like I just had. Time. So it's kind of like you hear about a heart attack. They talk about time. Strokes are the same way. You want to get to the emergency room as quick as possible. So call 911 right away if anybody you're around has any of those signs. But so we have a focus on Be Fast. So Beth Hunt, she'll have a table with all that information on how to recognize a stroke and what to do.
And then you mentioned the blood pressure cuff, and I see that there's some information on the flyer that you all will be giving some of those away.
Yeah, so that's part of our VDH and Brent's partnership. We'll be doing some blood pressure screenings free. And we have 60 free digital blood pressure cuffs. Now, digital blood pressure cuffs are not the best way to take blood pressures, but it's a great thing you can have where you can screen yourself, keep up with it. And high blood pressure is a symptom. Yeah. So
yeah. That's awesome. I think that the information alone is obviously going to be invaluable for anybody that comes in. And I think it's important for people to know that strokes can affect anyone.
They can.
At any age. It's not,
any age, any health.
And you see it all the time in healthy individuals that exercise regularly. Just quickly, are strokes something that's hereditary?
It is. Yeah. So my grandmother had a stroke too. And so, with my dad, we just have to make sure we keep him healthy and keep him active. And, now that we know that history, we can take preventative steps through diet, exercise, all those things. Nutrition, very important. Very important.
Yeah.
Not smoking, not drinking alcohol.
Yes.
We all know what to do.
Right.
And if it was easy, everybody would do it, wouldn't we?
Yeah. So we're kind of coming towards the end of our podcast, but before we do, I also want you to mention just real quickly some of your other events or activities that are coming up. I know the Paint the Town Pink.
Yes. So through the Stroke Smart event, just one more thing. We hopefully we'll start a community initiative after that event. As the community comes in, we're going to assess people who want to be part of a Stroke Smart committee. So doesn't have to be a nurse, doesn't have to be a clinician, but anybody that just wants to get the information and be an ambassador for strokes and educate at the Bauer Center or maybe at their church or at the YMCA. I don't know. But of course, that'll be a really cool thing we want to do just for our Bedford County community. You can actually get deemed a Stroke Smart community. So this is kind of the
direction.
This is the first step of that.
Wonderful.
So a couple things coming up. We have Paint the Town Pink on Friday, October 18th. And so this will be from 11:30 to 12:30, of course, in support of those with breast cancer and just awareness too, right? So I'm just turned 40, a week ago. So, I know what I need to do. I need to get a mammogram, but does everybody know that they need that? So that'll take place in Bedford Center Town Square. So everybody from head to toe.
Right.
Has pink everywhere.
And encourage your, your business, your organization, any entities to wear pink on that day, even if you can't make it downtown. That bit of awareness is important within your own community of individuals, whether it be your place of work or someplace that you may be visiting that day.
Yep. And then I know that we have another walk with a doc. So that we have one in November. And that'll again be at Bedford Memorial Hospital, right where those columns are, November 16th from 8A to 9A. And we're going to have an ED physician there and a hospitalist there.
Okay. Yeah.
So Dr. Basham and Dr. Firestein, both very wonderful doctors, and they're going to do it together.
Okay.
So they'll be really great to talk to.
Yeah. Well, and I understand that the best place for our listeners to find a lot of this event info is the Facebook page.
Yeah, I was just looking at that. So our BMH Facebook page. So it's, if you just Google on Facebook, Centra Bedford Memorial Hospital, you can join. And Mary is fantastic. She posts everything we need to know. Yeah. And then some.
Yeah. Well, there's lots of great opportunities and ways to get involved with these opportunities through the hospital. And I think these are just, wonderful events that are going on to make sure that our community hospital is a part of the community and that it's not just a place that you have to look for when you're in a health emergency or health crisis. You want to, be aware beforehand, but also be able to take part in some of these opportunities and get to know your healthcare providers. That's important.
And education. We just want to offer all the education we can. So,
Well, I want to thank you for joining us. And I also want to mention that we want to thank Centra and Centra Bedford Memorial Hospital for being the title sponsor of Bauer Center's upcoming annual fundraising event, Art of Pairing Bourbon and Blues, on October 19th. Tickets are still available. It promises to be a really fun evening. Check out our website for ticket information and all the information of what the evening includes. And we also had a podcast on September 24th. You can go back and listen to that podcast for all the details on that specific event. I'd like to mention that we'd like to invite our listeners out on this Friday, October 11th from 5 to 7. We are opening a brand new art exhibit today featuring artist Casey Morano, and it's entitled Returning to Water. It's really beautiful, the work that she's done, and it's on handmade paper and fiber. It's just really amazing. And there'll be a reception on Friday evening from 5 to 7 where Casey will be there. She'll give a little gallery talk about her exhibit, and there'll be light refreshments. It's complimentary. So we want to invite everybody out to that. Remind everybody the fall classes and workshops for youth and adults are now registering. That's all available on our website as well. We've got some new ornament making workshops for the holidays that are coming up. Those will be using clay and pottery ornament making workshops. So we hope people will look for those. And lastly, I want to mention that our next performance is next Saturday, October 12th. It's actually opera on the James Tyler Young Performers. They'll be performing Goldilocks and the Three Singing Bears. This is a free, family-friendly performance. It'll also include some art activities along with it. The kids will get to make some puppets and have light refreshments before the performance. It all starts at 11. It's perfect for ages pre-K through 5th grade, and the performance will actually start at noon. Tickets aren't required, but we do appreciate advance registration just so that we can have a head count beforehand, and all of that is on bowercenter.org. So again, I want to thank Carrie for joining me this morning. It was a lot of wonderful information, and I hope people will participate. Check out their Facebook page at Centra Bedford Memorial Hospital for more information. And this has been Behind the Bower. Thanks for joining us.
Thank you.